Let's read Sebastian's Surgery. Sebastian is very sad. He has a cyst. The cyst has pus and is very uncomfortable. He wishes it would go away. A doctor says he would like to do a surgery to remove Sebastian's cyst, if that is what Sebastian would like him to do. There are some risks of doing surgery, and Sebastian can ask the surgeon about these and ask him to explain. He can ask as many questions as he needs to ask to make the right choice for him. There are 2 steps to having surgery to remove his cyst. First is surgery day, then 2 weeks of special resting, which means laying on his stomach. First surgery, then rest on stomach. On surgery day, Sebastian goes to the hospital and needs to change into special clothes. The nurse will give Sebastian an IV, which will only feel like a little pinch for a moment. And then when it is time for his surgery, they will ask Sebastian if he is ready, and then give him medicine to make him sleep for the surgery. The surgery medicine will make Sebastian stay asleep for the whole surgery, so Sebastian will not remember it at all, and it will not hurt. When he wakes up, surgery will be all over. Sebastian will feel like he just had a nap. He will wake up in a hospital bed, like he was in when he went to sleep, but the room will look different. Doctors and nurses might need him to rest in bed for a bit, and to do a few things to check that he is doing well after his surgery. Sebastian does not understand some of the strange things they do at the hospital, like how the doctors want him to ride around in a wheelchair while he is there, even though he would rather walk. He knows this is just something they have everyone do while they are at the hospital though, so he decides to enjoy the ride. Sebastian is excited when it is time to leave the hospital. He rides in the wheelchair until he gets to where his family's car is waiting for him. Then he stands up and walks the rest of the way to the car. Then he waves goodbye to the doctors and nurses and watches out the window as the car leaves the hospital and drives him to his parents' house, where he will stay for some of his rest time, unless he would rather rest at his group home. After surgery, Sebastian knows there will be a wound left from where the cyst used to be. It might hurt, but the doctor will give him some medicine he can take to make it more comfortable, and it will only hurt for a few days. Then it might be a bit sore for a few more, but eventually it will feel better. When he gets to his parents' house, Sebastian finds a comfortable place in bed and lays down on his stomach. When he needs to go to the bathroom, Sebastian can get up and go, but when he is not in the bathroom, he lays on his stomach again. It feels a bit weird at first to spend all that time on his belly, but he knows this is the best way to let his surgery heal up, so it will feel better. There are many things Sebastian can do laying down on his stomach. He can watch TV, listen to music, play computer, make songs with his sister, sleep, read stories with his mom, call his brother. He can even eat dinner with his dad, all while laying on his stomach. After Sebastian's surgical wound is feeling better and he has been resting on his stomach for many days, he can go back to his house. He will still need to keep laying on his stomach while he does things for more days. But after it has been 2 weeks, or 14 days, he won't have to rest on his stomach anymore. After 2 weeks laying on his stomach, Sebastian doesn't need to lay on his stomach, except if he wants to. He can sit normally too and doesn't need to rest anymore. After more time passes, Sebastian's wound has healed up completely, and all that is left is a tiny scar. He feels better now, and the cyst is gone. Sebastian is glad he was brave and let the doctors help him, and that he did a great job resting on his stomach for so many days and nights. He is proud of himself, and everyone who loves him is proud of him too. Good job, Sebastian.